little bit about access to services. So the access to services section, or we affectionately call ourselves ATS, and we make the T small just because. You'll see it in different ways, but we are a total of 20 team members, and it includes me, the manager. We also have Miss Bell, who is the front desk receptionist. And I know since COVID and y'all are new coming on, you haven't had an opportunity to meet Miss Bell, but if you're ever up at 2 Peachtree, when we're back in the office, Miss Bell will be the person who greets you at the door and lets you in and gives you direction as to kind of where you need to be. So we're excited to have her on our team. And then we also have within our section, the Aging and Disability Resource Connection, which is also a team and a team of staff, and we'll get into the work that everyone does next. And so we have a team lead and then staff members that work with the ADRC team. Again, we call it ADRC. We have a senior legal services developer, and she manages the statewide elderly legal assistance services program. And again, if you've been at DAS for very long, you know that we use a lot of acronyms, and so that is ELAP. Last but not least, and you're going to hear from her after I speak, is the Georgia Cares team, and that is also a team of staff. And all together, we make up 20 people. So we have a great team and do awesome work. Oh, hang on, my slide did not change. There we go. So Aging and Disability Resource Connection is known at the national level, and we call it the No Wrong Door. Can you hear that?
Yes.
All right, so I probably don't have to go any further than that, not to get to the who you're going to call. So who are you going to call? You're going to call the ADRC. So what does the ADRC do? So it's the No Wrong Door. So when I think about the No Wrong Door, I think about it as it's the door to a house. So, but the house has many rooms and many doors, and you can get to where you're going from going through a variety of rooms because we're a network, a connection across the state. So what we're going to look at on this slide is just who comprises, what does the ADRC do? What are some of our specialties? So you can call and get to information, assistance, and referral. You can learn about long-term services and supports, aging and disability. So we serve consumers of all ages and provide support or information and assistance. So we also have a wide resource database called ePro, and that is something that all of our folks have access to, that they can help people that they're on the phone with learn about services that are near them and get that information. We also have, I don't think it's live on our site yet, but we work with the Atlanta Regional Commission, AAA, on this, and this is their ePro database. And we also have what's going to be coming, is already partially available, is self-service. So if that's someone like me who maybe at 10 o'clock at night, I need to search to learn about services and supports for my dad, and I can get onto our website or get on any area aging website, any of our partners, and be able to do a self-service of kind of a light database. So that's really good. That's an excellent thing that we're going to be able to be providing. So the other thing that's really unique about us, that we do unbiased referrals. If you're watching television and you see a Place for Mom, or you see some of the other services, they're going to skew you potentially towards certain vendors. And we are going to pull up information and give you unbiased referrals and information to provider organizations, so you can make choices and decisions. We also, at the ADRC level, our team members do Older Americans Act programs, non-Medicaid assessments. We also do assessments for the Elderly and Disabled Waiver Program, which is Medicaid. We provide options counseling which is talking with, so you've learned, someone needs services and supports, and we can offer to have an options counselor talk with you about building a plan. Like, what is it that you need? What are you looking for? Sometimes people call and ask for one thing, but as they learn about all of the different options that are available, they might go in a completely different direction of what they're looking for, add on additional services and things that they didn't even know existed. We also do transitions programs, so that's transitions from nursing homes, and some of our partners do transitions from hospitals back to home. And then again, like I said, we're called the No Wrong Door. So again, you can get anywhere through connecting to us. So the eligibility assessments, you can see, so we do some triage, which determines Older Americans Act targeting criteria. And you knew, if you were on yesterday, I believe you learned a good bit about the Older Americans Act. We also have an assessment that's called the DON-R, which is the Determination of Need Revised, which measures functional impairment and unmet in activities of daily living and instrumental activities of daily living. So those are looking at the things that you're able to do and maybe what you're not able to do. We do the Food Security Survey, measures food security, identifies individuals who are food insecure, and you'll be hearing more about that as you're going through orientation. We do the nutrition screening, have a nutrition screening initiative, which identifies individuals at nutritional risk, regardless of food security. And we also can do an income worksheet, which helps to determine cost shareability and or eligibility for the EDWP waiver program. Sorry, I keep hitting the wrong button. So options counseling. So a little bit more about that. We have two different types of options counseling. So we have the MDSQ options counseling, which are for individuals who are currently in a nursing home and have expressed interest in returning back into the community. And so they go through, can work with an options counselor to help them determine eligibility for the program, and then can provide an action plan for transitioning with or without the transition program. So not everybody would necessarily qualify for one of the programs, but you can help, our options counselors can help them develop a plan to be able to get back home or get back out into the community. We also do the community options counseling, which is provided to individuals who are still in the community. And it explores long-term services and supports, different options that might help delay or even prevent long-term care facility placement. The community options counselor works with the consumer and their care partners to develop an action plan, and it helps to provide follow-up. They provide follow-up on the action plan to verify and or amend it as needed. So our transitions programs that we operate are Money Follows the Person, which is community transitions, and it's Medicaid focused. So individuals who've been in the facility for 60+ days, and so this is a long-term care skilled nursing facility. Individuals' long-term care stay has been paid by Medicaid for at least 1 day. So if you think about it, sometimes people will go into a nursing home under Medicare, and at however many days that they have for Medicare, and then they might transition onto Medicaid. So that's how you need to be eligible, because the plan is that you would take that Medicaid into the community with you. So the individual would maintain the participation in order to go into the community and potentially qualify for one of the waiver programs. And that's federally funded. And then we also have the nursing home transitions, or non-Medicaid, and that's for individuals who have been in a facility for 20+ days that are at risk of permanent placement. So let's say, someone might have had an accident or surgery that required them to need to go into a nursing home for physical therapy, and they really want to get back to their home or their apartment or back home with family, wherever it is that they'd like to be. But if they're going to be in the facility for too long, they would risk being able to maintain the cost of that, or being able to actually see a way to get back there. Sometimes, individuals can get stuck. So there's no income or resource caps, and it's available. We can work with consumers that are 55+. And that is state funded. We have state funds to do that program. So these are some of our partners. As you can see, we have a wide variety of partners that we work with. This isn't everybody, but this is some of our main partners. So you can see we work with the Georgia Department of Community Health. We work with the Brain Injury Association of Georgia, the Statewide Independent Living Council, the Centers for Independent Living. We work with Disability Link, the Georgia Department of Behavioral Health and Developmental Disabilities. We work with the Brain and Spinal Injury Trust Fund Commission. We work with all of the AAAs. We partner with my GCAL, and we are so excited to have a new contract in place with Georgia Tech and Tools for Life. And of course, money follows the person. So we're excited to have all of these different partners, and they serve as part of our Aging and Disability Resource Connection. So they help to grow our network. So I said no wrong door. So AAAs across the state serve as the central hub of the no wrong door wheel. So they partner with other agencies across the long-term services and support spectrum to ensure seamless connection with appropriate services and supports. So I just mentioned some of the agencies that we work with, and here's just a list of their names. We're also really excited to be partnering with the Veterans Administration. This has been something we've partnered with them over the years, but we have made a really strong connection in the last couple of years with the Veterans Administration. And we actually, in the last options counseling class, Lorraine Barr, who was the options counseling specialist at the state, we had several Veterans Administration employees that are now certified options counselors. So that's something we're really proud of, that connection. And then I didn't have the logo for it, but we also partner with Emory's Memory Assessment Clinics, or the MACs. So how do you connect to the ADRC? You call our 866-552-4464 and press option 2. And that will, it's a smartphone system, so it'll get you to the Area Agency on Aging, which is in the community that you live based off your area code, or it'll rotate around the state where anybody can answer the phone and get you, anybody at a AAA, ADRC can get you to the right resource. You can also access through our website, which is a new website. We're really excited. We debuted a new and improved website last year. So this is our website, so georgiaadrc.com. So next I'm going to talk a little bit about Elderly Legal Assistance Program. And you remember I mentioned our Senior Legal Services Developer, that's Natalie Thomas, and she is an attorney. She's been with us for, I believe, 20 years, right around 20 years. And we're just excited to share information about this program. So the Elderly Legal Assistance Program, also known as ELAP, provides legal assistance in non-criminal matters. Oh, I'm going to tell you, you need to pay attention because we have a little quiz at the end. So it provides legal assistance in non-criminal matters, such as accessing health and long-term care, debt collection, housing, consumer issues, Medicare, Medicaid, Social Security, elder abuse, exploitation, and fraud, defense of guardianship, advance directives, some end-of-life issues, and other legal services. So those are all of the different things that ELAP can help you with. They provide services to individuals 60 years of age and older, and there is an ELAP program in every state. Every county, they serve every county in the state of Georgia. Excuse me, I was getting ahead of my, getting big. So is ELAP a state program? No, it's federally funded through the Older Americans Act, Title IIIB, and it's required that the state have an ELAP program. It's one of the 3 required, well, here I say it again, priority services under the Older Americans Act that area agencies must fund with Title IIIB. It also receives matching funds from the state and local governments, and it receives in-kind support from the providers of the services. ELAP doesn't charge. There's no charge to consumers that qualify for ELAP. They provide legal information, legal community education, or client representation. So that may be in a legal case, it may be writing a letter, it may be making some phone calls. While the program welcomes all voluntary contributions and donations, they are not required to receive services. So there are no, so let's see, the question is, do people go through income tests in order to become eligible? So the quick answer is no. There are no income limits that would keep one from being eligible for services. In fact, means testing or basing eligibility upon a person's income or assets is federally prohibited. So that's the good thing about it. It's open and eligible for all who are 60 and older. First, the ELAP program assists people that are 60 and older in the most social and or economic need. They focus on low-income minorities. They focused on limited in English-speaking proficiency or in rural areas. So these are their main first focus points. Second, the person must have the type of problem that is handled by the ELAP program. So it must fall within their priorities or at least be the type of case that they're allowed to handle in order to be eligible for services. So let's see, Jennifer. Gosh, I know I went through that quickly. Do you want me to get out of this? Because these are our quiz questions.
Or we could just do them from your screen.
Oh, okay. I thought you set up a, okay. All right, so I can't see the answers or what y'all are gonna answer or raise your hands for. So let's test your ELAP knowledge. Which of these is appropriate for ELAP? A 75-year-old who's been charged with a DUI, a 59-year-old served with an eviction notice, an 80-year-old requesting a temporary protective order against his 29-year-old grandson for repeatedly hitting him and threatening to kill him.
C.
B.
Yeah, B.
Y'all bear with me, sorry.
I'm seeing, yes, C and B.
All right, the answer is C. Did I just share my screen? I probably did. All right, I'm going to read the next question. We'll just go away from my, So true or false? Area agencies on aging can choose not to fund ELAP.
False.
Anybody else? Everybody saying false?
I see a true.
Well, the answer is false. It is federally mandated. Let me go back and check and make sure. So Title 3B legal is a priority service under the Older Americans Act and is required to be funded. Last one. True or false? ELAP providers are able to charge clients for their services.
False.
Yes, that
Yes.
is false.
False, yes.
The Older Americans Act prohibits this. Services are required to be provided at no cost to clients. So excellent test of knowledge. Let me see if I can quit sharing my screen. Was I successful in stopping sharing my screen?
You were.
Awesome. Well, I don't know how, let's see. So I am going to turn it over to Christine Williams, and then we could do questions at the end, I guess.
Okay.
All right, thank you.
Hi, good afternoon, everyone. My name is Christine Williams, and I am going to talk about the Georgia Cares program. Let me go ahead and turn on my, okay, very good. All right, so good afternoon again. I am here to talk to you about the Georgia Cares program. which is the State Health Insurance Assistance Program. So what you see on the screen is our mission and our vision statement. So the State Health Insurance Assistance Program is a federally funded program. We are missioned or are tasked with providing education to Medicare beneficiaries. So there is a state health insurance assistance program in every state in the country. So here in Georgia, we just happen to be called Georgia Cares. If you go to another state, there is a state health insurance assistance program there. The name will be different, and it may be actually administered through the Department of Insurance versus the State Unit on Aging. But our mission statement is to empower, educate, and assist Medicare eligible individuals, their families, caregivers, and providing counseling to folks. So we do one-on-one counseling as well as outreach and education in the community. And then we also for SHIP is the vision statement is to be the known and trusted community resource for Medicare information. And so just click real quick. What do we do? So we provide Medicare information. So we go over all parts of Medicare. So we go parts A, B, C, and D. We talk about wellness and preventative services dealing with Medicare. We talk about financial assistance programs. So we screen individuals to see if they are eligible to get assistance from the Division of Family and Children's Services, dealing with co-payments, co-insurance, and deductibles. We also help people file for appeals and grievances in case they have a problem with a service, things like that. And then we also, again, explain all parts, and we also provide that impartial and personalized counseling. Now, our outreach and education component, we do like to partner in the community with nonprofit organizations, anyone that would like to partner with us in reference to providing services to Medicare beneficiaries and helping to get the word out about services and what we do. Part of our program is we also receive funding for the Medicare Improvements for Patients and Providers Act. So that's known as our MIPA funding, and that is additional funding specifically to help individuals enroll into financial assistance programs. So basically, we actually provide services helping people apply for the Medicare Savings Program through DFACS. So we use the Georgia Gateway website. And then we also help people apply for the low income subsidy program that will help with their prescription drug costs. So if someone's struggling to pay for their prescriptions, then we'll help them apply for the low income subsidy program, also known as the Extra Help program, through the Social Security Administration. And then, of course, that program or that funding specifically is dollars for wellness and preventative services, in which we normally like to talk to people about their Welcome to Medicare visits or their annual wellness visits that they are entitled to. And then that also has an outreach component where we are out in the community doing presentations, doing health fairs, things like that. And so, of course, right now, everything's virtual that we're doing. And so again, part B, which deals with preventative services. We really go into a lot of detail about the Welcome to Medicare preventative visit. It's important that when folks first are on Medicare, if they first sign up, that they know they're entitled to that. And then also their yearly wellness visit. So for folks that already have Medicare, every year they're able to get a yearly wellness visit in which they talk to their physician via telehealth or in person, and they're able to discuss some of their concerns about their medical condition. They put together a preventative prevention plan for them. They fill out a health risk assessment, a questionnaire, things like that. And what you see on the screen are just some of the preventative services that are included. We really like to kind of explain all the preventative services that are available to folks. So there is a Medicare and You handbook that they receive every year, or they can go to the Medicare.gov website, which has a full list of all the Medicare preventative services that they're entitled to. And it gives you the details about how often you are entitled to that preventative services, what is the criteria for you to receive it, and things like that. So again, help for people with limited income and limited resources. We really try to focus on folks that are struggling or low income, limited assets, and paying for their Medicare services. So we do talk to them about Medicaid. So again, there's SNAP and other temporary assistance for needy families, things like that, that they can apply for through Georgia Gateway. And then also that Medicare Savings Program, which is exclusively for Medicare beneficiaries to help pay for their premiums, deductibles, and coinsurance. And then that extra help, that low income subsidy program that will help with the out of pocket costs and dealing with prescription drugs. And so we also like to make sure that folks know about the vaccine and making sure that, because we get a lot of phone calls and sometimes folks just aren't sure. They are not really sure where to get it or how to sign up, things like that. So we do like to tell our seniors if they have any questions about that, we make sure we give them information. So again, just making sure we're promoting and partnering with the Department of Public Health and making sure that folks can get the information that they need. Here are some of their flyers and promoting people getting the vaccine. And then also the marketplace. So the marketplace has been extended. So there's a special enrollment period now for folks that are 19 to 64 that do not have Medicare, that are looking for health insurance. They are able to go ahead and enroll in that marketplace coverage through healthcare.gov. And so that extension for that special enrollment period will go until August 15th of this year. And they have a separate 800 number that they can call. And there is a organization that's receiving federal funding to help individuals. It's called Georgia Primary Care Association. They receive federal funding to help people enroll into the marketplace, as well as there are Georgia navigators that help folks enroll into the marketplace also. So locally, you can go to healthcare.gov, find a local navigator or a company or a nonprofit that's able to help you. They do actually have insurance agents that are navigators also, but it will distinguish that on the website. So if folks feel more comfortable with a nonprofit or they feel comfortable with an insurance agent, they're able to get that information also. This is the website, healthcare.gov, if you haven't been there before. It was an easy website, just putting in your zip code and information, and it will walk you through a process in reference to getting health insurance. And so our collaboration with this is we don't actually enroll people into these programs, but folks are always transitioning on and off of Medicare, and sometimes they may have had the healthcare.gov coverage, and so that might be something that they will be transitioning from or to. We also have a component where we talk about scams and COVID-19. So of course, during this time, there is an uptick in all of the different scams. So we like to just include some information. Some of these scams have been around for many years, charity scams where folks are soliciting for money and donations. So we like to tell our Medicare beneficiaries to be aware, make sure that you understand and know before you donate to a particular charity or organization. We also like to talk to them about phishing scams. Again, folks that are posing as national organizations or international organizations, sending them emails, things like that, downloading malware onto their computer or laptop. So we want to make sure that they understand before they click on these types of emails. Also, app scams. So again, dealing with your smartphone, you might be downloading an app, make sure it's from a reputable source. Also investment scams, things that have been around for many years, but again, people are going and using social media a lot. So different websites that they're going to and they're really not familiar with them. So before they invest any money or take monies out of different places and are investing in certain things, that they make sure it's a legitimate source, dealing with the Federal Trade Commission or any other organization that may be able to legitimize before investing any money. And then also testing scams. So again, folks were going around, fake at-home kits and door-to-door trying to get monies from individuals for testing. And so our contact information, just like the ADRC, the 866 DAS toll-free number, we are option number 4 on the phone tree. And then we do also have a call center where we are available Monday through Friday. in which we have certified Medicare counselors available to answer questions for individuals. We have our website, we also have a newsletter, and then we also are on social media on Facebook. So we do some posts also. And that is it.